Video lecture chapter 3, Radiation Biology. Radiation injury. Mechanisms of injury, theories of radiation injury, dose response curve, stochastic and non-stochastic radiation effects, sequence of radiation injury, determining factors of radiation injury. Mechanisms of injury. Some X-rays do not reach the dental X-ray film. They are absorbed by the patient's tissue. Chemical changes occur that result in biologic damage. Two possible mechanisms of radiation injury include ionization and free radical formation. Ionization results when X-rays strike patient's tissue. These are produced through photoelectric effect or Compton scatter, results in formation of positive atom and dislodged negative electron. This electron will interact with other atoms within the absorbing tissues, causing chemical changes within the cell that results in biologic damage. Free radical formation. Cell damage occurs primarily through formation of free radicals. Free radicals are formed when an X-ray photon ionizes water. Free radical is an uncharged atom or molecule that exists with a single unpaired electron in its outermost shell, is highly reactive and unstable. Theories of radiation injury. Damage to living tissue caused by exposure to ionizing radiation may result from a direct hit and absorption of an X-ray photon within a cell, absorption of an X-ray photon by water within a cell accompanied by a free radical formation. Two theories to describe how radiation damages biological tissue includes direct and indirect theory. In direct theory, cell damage results when ionizing radiation directly hits critical areas within the cell. This occurs infrequently. In direct theory, X-ray photons are absorbed within the cell and cause the formation of toxins, which in turn damage the cell. When X-ray photons are absorbed by water within a cell, free radical formation results. The free radicals combine to form toxins that damage cells. Dose response curve. Curve is used to correlate the damage of tissue with the dose of radiation received. A linear, non-threshold relationship is seen. A linear relationship indicates that the response of the tissues is directly proportional to the dose. The non-threshold dose response curve suggests that no matter how small the amount of radiation received, some biologic damage occurs. Stochastic and non-stochastic radiation effects. Stochastic effects, a direct function of the dose. No dose threshold effect does not depend on magnitude of absorbed dose. Non-stochastic effects. Somatic effects that have a threshold. Effects increase in severity with increasing absorbed dose. Sequence of radiation injury. We have the latent period. This is the time that elapsed between exposure to ionizing radiation and the appearance of observable clinical signs. This is going to depend on the total dose of radiation received and the amount of time it took to receive the dose. The period of injury is a variety of cellular injuries that may result. The recovery period, depending on a number of factor cells, can repair the damage caused by radiation. And cumulative effects, the effects of radiation exposure are additive. Unrepaired damage accumulates in tissues. Determining factors for radiation injury. Total dose, dose rate, amount of tissue irritated, cell sensitivity, and age. Radiation effects include short-term and long-term effects, somatic and genetic effects, radiation effects on cells, and radiation effects on tissues and organs. Short and long-term effects. Short-term effects associated with large doses of radiation in a short amount of time, acute radiation syndrome, or ARS, includes nausea, vomiting, diarrhea, hair loss, and hemorrhages. Long-term effects. Small doses absorbed repeatedly over a long period of time, effects seen after years, decades, or generations, include cancer, birth abnormalities, and genetic effects. Somatic and genetic effects. Somatic cells, all cells in the body except reproductive cells. Genetic cells, the reproductive cells. Biologic effects of radiation can be classified as somatic or genetic. Somatic effects are seen in the person irradiated and not seen in future generations. Genetic effects are not seen in the person irradiated and passed on to future generations. Radiation effects on cells. A cell that is sensitive to radiation is termed radiosensitive. One that is resistant is termed radioresistant. The response is determined by mitotic activity, cell differentiation, and cell metabolism. Radiation effects on tissue and organs. Radiosensitive organs include lymphoid tissue, bone marrow, testes, intestines. Radiosensitive tissues include salivary glands, kidney, and liver. Radiation effects on tissues and organs. Critical organ, an organ that, if damaged, diminishes the quality of a person's life. Critical organs exposed during dental radiographic procedures include skin, thyroid gland, lens of the eye, and bone marrow. Radiation measurements. Units of measurement, exposure measurement, dose measurement, dose equivalent measurement. Traditional older units of radiation measurement include Röntgen, radiation absorbed dose, Röntgen equivalent. SI or newer units of radiation measurement include kilos and kilogram, gray, and sievert. Exposure measurement. Röntgen. Röntgen measures radiation by determining the amount of ionization that occurs in air. It does not describe the amount of radiation absorbed. No SI equivalent. Exposure is stated in kilos and kilogram. Dose measurement. The amount of energy absorbed by tissue. Traditional unit is the rad. SI equivalent is gray. 1 gray equals 100 rads. Dose equivalent measurement. Dose equivalent measurement is used to compare biologic effects in different kinds of radiation. Traditional unit is the rem. SI equivalent is the sievert. 1 sievert equals 100 rem. Measurements used in dental imaging. Milli means 1,000, used to express small doses used in dental imaging. Radiation risks. Source of radiation exposure, risk and risk estimates, dental radiation and exposure risks, patient exposure and dose, risk versus benefit of dental images. Sources of radiation exposure. Natural background radiation, a form of ionizing radiation that is in the environment, including cosmic and radioactive materials in the earth and air. artificial or handmade radiation resulting from modern technology. Risk and risk estimates. The potential risk of dental imaging, including a fatal cancer in an individual, has been estimated to be 3 in 1 million. The risk of a person developing a cancer spontaneously is much higher, or 3,300 in 1 million. Dental radiation and exposure risks. Risk estimates: thyroid gland, bone marrow, skin, and eyes. Patient exposure and dose, including speed, collimation, technique, and exposure factors. Risk versus benefit of dental images. Dental images should be prescribed for a patient only when the benefit of disease detection outweighs the risk of biologic damage. When dental images are properly prescribed and exposed, the benefit of disease detection far outweighs the risk of damage. This concludes our lecture.